Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. Hey everybody, welcome to day 24 of the 30-day podcast challenge, 30 days to being a badass ER nurse. For today's tip, I want to remind you about a pediatric assessment algorithm, or maybe I'll teach you about a pediatric assessment algorithm. Now, hopefully you remember that the first step of assessing your pediatric patient is what we call the pediatric assessment triangle. It's your first impression of the child when you first lay eyes on them. It's before your primary assessment, before your secondary assessment, before all of that. It starts with the pediatric assessment triangle. The pediatric assessment triangle has 3 steps. It has A, B, and C. In this case, A stands for appearance. What does that child look like? Are they awake? Are they alert? Are they floppy? Do they have any kind of muscle tone? And I'm going to give you a little acronym to help you remind what things to look for with appearance. Give you that here in just a second. B in the pediatric assessment triangle stands for breathing. What does their breathing look like? What's their work of breathing? Are they working hard to breathe? If they are, you know that child's sick. You got to get to that primary assessment pretty quick. C stands for circulation. What does their skin look like? Do they obviously have a pulse? What does their circulatory status look like? Are they pale, cool, and clammy? Are they warm, pink, and dry? When you're doing that initial pediatric assessment triangle, you're using all of your senses to evaluate that child well before you touch them. This is going to help you look for life-threatening situations in that pediatric patient. Now, I'm going to give you a little acronym to remember some of the critical steps of appearance. That assessment algorithm is called TICLS. The T in TICLS stands for tone. What does their muscle tone look like? Are they a floppy baby? Floppy babies scare me, and they should scare you too. Or do they have good muscle tone? Are they holding themselves upright? Are they holding on to mom or dad? If they have good muscle tone, that's a good sign. I in TICLS stands for interactive. Are they interacting with their environment? Is their mental status okay? Is their level of response okay? Are they interacting with the caregiver? Are they responding to you as a healthcare professional? Depending on the age group, they should be afraid of you when you first approach, because we'd like to get up close and personal, and that may not be the best thing to do first off. So take a minute, hold back, and see what their response is to you. The C in TICLS stands for consolability. Are the parents able to comfort the child and help them calm down and stop crying? If they are consolable, that's a good sign. If they're absolutely not consolable, that's a bad sign, and that's a child that may be in trouble. The L in TICLS stands for look or gaze. Do the child's eyes follow your every move? They should. Like I said, they may very well be afraid of you, and if they are, that's okay. That's not a bad sign. Are they following you and tracking with their eyes, or are they just staring off into space? Or maybe they look completely unresponsive. Again, bad signs. And then the S in the TICLS acronym stands for speech. Do they have a good speech and crying? Do they have a good, strong cry? Or is it weak? Is it muffled? Is it hoarse? That'll tell you a little bit about the patient's airway and whether or not you know you need to be concerned. So again, this acronym to look at the appearance is called TICLS. Tone, interactivity, consolability, look or gaze, and then S is speech or crying. That is the TICLS acronym for evaluating their appearance. I hope this tip helps you evaluate your pediatric patients. I hope you had a great weekend. Thanks for listening.
Thanks for
Have a
listening
great
to
shift.
the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.